What led you towards that kind of Eastern philosophy?
Everybody got a personal journey. I think most of the time we debate what comes first, whether it's a brain or mind, experiencing in our brain affecting our mind, or mind is affecting our brain.
Because I read one of your article, you mentioned that healing is not just the body, it's also of the consciousness.
We need to understand that your mind and body are interconnected.
You pioneered multidimensional healthcare, right? What is that?
I had a guru. He's the one who inspired me to understand the concept of happiness.
Can we treat actually the body part using the mind or vice versa?
When you're anxious, what happens? Now, they have a connectivity because mind and body are connected.
A lot of social channels, a lot of reels, stories we keep seeing. Sometimes you lose track of what you are watching.
India has become a suicide capital, for example. We will have a major challenges of mental health by 2035, and we're not prepared for that.
Dr. Sukul, it is a pleasure to host you at Medical Value Talks.
It's a pleasure, all mine. Thank you. Thank you, Nitin.
Thank you, sir. Dr. Sukul, you have worked beautifully. How you come about bridging such kind of a beautiful concept?
Well, I think if you talk about psychology, most of the time, like when I got trained in India, it was more about following the British psychiatry. In 1990, I moved to UK, and there I worked for one of the biggest psychiatric and psychogeriatric hospitals. And then I got a consultancy work with one of the most reputed integrated healthcare clinic called Hale Clinic. So the patron of the clinic was now King Charles, So it was my first work where, because I got trained when I moved to UK, I also got trained in RxOne hypnotherapy, psychotherapy, and NLP, neuro-linguistic programming. That was quite new at that time. So when I started practicing at the Hale Clinic, what I noticed that, a lot of people started coming to me to talk about past life regression, hypnotherapy, past life regression, life after death, or what happens, if there are certain traumas, or even at that time in 1990s, a spiritual movement was in the peak, at the peak at that time, because a lot of people, they were practicing meditation, yoga, chakra,
Right.
chakra kind of stuff. Yeah. And then when energy started moving, sometimes they used to have a brief psychiatric or psychotic episodes. So when you come out of your country, you start thinking about what is there in your country, the country where you're born. That was the time when I started connecting the concept of consciousness, life after death. When you do the past life regression, then there's something that is stored in your unconscious mind that is affecting your present life. So that was a time when I started exploring Vedic science or Eastern science. It was there, but when you talk about philosophy, there is no concept of Eastern philosophy. It is called Darshan Shastra. You might have heard this,
Right. Yeah.
the word called Darshan.
Right.
Philosophy is a very cognitive process in certain ways, whereas Darshan is more like experiential. So when you experience something, say for example, you don't see happiness. What do? You experience happiness. You experience the state of bliss.
Right.
So when I started reading a little bit more about past life and some of the work by Swami Abhedananda, I started understanding that basically when you talk about a spirituality in India or in Vedic science, in Sanatana, it is nothing else. It is all work on mind. So that was my first understanding of mind and its connectivity, subconscious mind, unconscious mind, etc. And I think that is how somewhere I was very lucky because addiction has been my specialist field. So I used to work in India. In India, I worked with Delhi Police, Kiran Bediji, Navjyoti Clinic. She is also my mentor, in certain ways, because there are people, those who think outside the box.
Right.
And she was one of those. So when I started working, I got a job to run one of the Princess Diana's project.
Wow.
That was turning point. And in this job, what I have noticed that we are treating patients, and then after a couple of months, they're coming back to us. There are high rates of lapses and relapses. So that was the time I started thinking what we can do differently to help or assist our clients or patients.
Wonderful. That's so profounding. But at the same time, that raises a kind of question in my kind of engineering mind. I come from that kind of background where I question everything. So what I have learned is that brain is a chemical system, right? And you're talking about spirituality, etc., etc. How you were able to, because your, I think, education was also initially Western, and then what led you towards that kind of Eastern philosophy? Was it like more of a personal experience which led you to this discovery, or it was something else?
I think everybody got a personal journey. So I think most of the time we debate what comes first, whether it's a brain or mind, what is influencing, whether these are the chemical changes, what we experience, or what we are experiencing in our brain affecting our mind, or mind is affecting our brain. So this is all highly debatable subject. But what we cannot debate about, that there is something that is called consciousness. That is what we call in India, in Vedic science, is called Chetana. So, and each and everything, there is a consciousness. So when you start connecting with consciousness, there are a lot of things which you started experiencing within yourself. Because when you start questioning, like you come from the engineering background, I come from the background where we still have to question why we are doing it. And then when I introduced the concept of integrated approach to addiction, when I was working for Turning Point, I remember that I had a great discussion with one of the psychiatrists and the team of the doctors. They said, why you're bringing this Ayurveda, music and mantra, color therapy, reflexology, acupuncture? It's not based on science. It's not based on evidence, right. For example. At that time, Ayurveda was not promoted in the West at all. I mean, it was there. But what is science? What is evidence? Evidence is something where you can show people that if there are 10 people, those who are coming to us, they have a longer, their quality of life is improved, but also their rates of lapses or relapses are less. This is how we started talking about evidences. And as a matter of fact, when our project, when I introduced this concept of integrated approach to addiction, our project was reviewed by independent body called Alcohol Concern, and they said this is the most beautiful concept where you can retain the patient in the services and then reducing the cycle of lapses and relapses.
Wonderful.
So when you start doing this and you start showing the evidences, because, for example, one of the things which I always ask my fellow doctors and people, those who are brainy like you, so I always say, okay, so there are two people. They have a similar biochemistry, similar infection. We are giving them antibiotic, one person responds to antibiotic, other doesn't. Why? Because in science, what we do, that there should be similar reaction. But there's something else that happens with this. For example, we know that in the cases of cancer, or even in the cases of any mental health or physical health problem, if we have a positive outlook, our recovery is much more quicker. So it means that there's something else that is also working, not only on a biochemistry, but it's your mind that is affecting your biochemistry too.
Right. So I think you're talking about the healing of consciousness, not just the body. Because I read one of your article, you mentioned that healing is not just the body, it's also of the consciousness. Is that what you are referring
I
to?
think the consciousness is everywhere. So it's not about just consciousness or healing of the consciousness. We need to understand that your mind and body are interconnected. So what I always say, that your mind is a bridge between your body and soul. Now, when you take your mind towards your body, what happens? That we are engaged only on a sensory level.
Right.
When you take your mind upward, then we go towards the Atma or consciousness, which we call supreme consciousness or state of bliss. That is state of bliss, that is what is required for us in this world. For example, whatever you do, there are a lot of people in this world. If I ask them, what you want, they will say, oh, I need a car, I need this, I need that. But what is the basis of that? You will see that everybody is looking for happiness. Right. But happiness, which is, if it is based on pleasure, that is dopamine, for example.
Yeah.
Right? Now you know. But if you're talking about the state of happiness, that what we call continuity of happiness, that comes and that derives from experiencing the truthfulness of yourself. That is your supreme consciousness. When you connect, that is more like a serotonin. So there is a difference. Even on a biochemical level, we understand that what dopamine, for example, is your pleasure. Serotonin is more about the continuity of happiness. So when we start connecting all this, we'll understand that your mind is the bridge between your body and soul. But mind is the one, if you train it properly, it should rule your body instead of your body ruling your mind.
Wow. It's so deep to be very frank about it. And that leads to me another kind of intrigue which I have. You pioneered multidimensional healthcare, right? What is that? Right. So if you can.
So I think you need to understand the background before that. The journey of my life is not on my own. It's not my journey only. I'm inspired by many, many people in my life. For example, I just shared the work of Kiran Bediji. Even Prince Charles at that time, he's a King Charles, but his understanding about Vedas, his understanding about the spiritual sciences, it was also a source of inspiration for me. Wow. But I had a guru, his name is Rajan Sharma Maharaj. He is not in the body at the moment. He's not in the body, but he's the one who inspired me to understand the concept of happiness. With the help of, there's one Ayurvedic physician, when I started my clinic, he was the one who guided me, Dr. Ep03. He came and so we started talking about what is health. Most of the time when we talk about health, we're just talking about body. Or sometimes, if we are lucky, we talk about mind too, right? But it's not just about the mind and body. So all multidimensional healthcare, how it is started, is that's also a journey. What I had at Turning Point, for example, that one of the major reasons why we were experiencing lapses and relapses in the field of addiction, because you treat somebody for a couple of hours in a week or so, but then they're staying in the same environment. So there's energy where family members, they have a distrust or mistrust. They are thinking that this person is now trying and maybe after a couple of months, he will just go back. We also understand that there's something that is called chakra.
Okay.
Have you heard the name of chakra?
Yeah, yeah.
It's
So,
energy cycle.
to be very fair, in my childhood days, there was a serial called Shaktiman.
Right. Wow.
So, the first time I heard about chakras is from there.
Wonderful. So chakras, it means energy. So there are 7 kind of chakras, right? The first chakra is Muladhara, which is your base chakra. That gives you, like, you need to be grounded in this world. Our major problems comes with the second chakra, that is called Swadhisthana chakra. What is Swadhisthana? That's sacral chakra in English. What does it really mean? It represents water. Say, for example, your first chakra represents earth. That's why if you just think about it, you know, the body is made of anomaya kosh, like, 5 elements, for example. But your second chakra, that is a chakra where there is a water, and water is related to your mind. Now, all these unconscious memories that what we have, they stayed in our subconscious mind in your second chakra. So if there is imbalances in second chakra, then what we are going to do, we will experience lot of suppressed fears and desires. So in healthcare, what is important when we do the chakra assessment, we also look at which chakras are overactive or underactive and how they are affecting our life. So when we talk about multidimensional is based on comprehensive assessment of the patient. What does it mean? That everybody got expertise. For example, that I'm a clinical psychologist, so I can see things from the psychological perspective. There's somebody who's a medical doctor, for example, psychiatrist or general physician. They can look at things from their perspective, like the body perspective.
Yeah.
Somebody who's trained in energy and they can sense the chakras and all that, they can assess the patient based on what are the imbalances on chakras and energy in the environment. So we understand that all these 4 dimensions, they look different. Your body, mind, energy, and environment, but they are interrelated. For example, that you might have noticed that if there is an argument going on somewhere and you're part of that argument, it's going to affect you.
Absolutely.
No?
Absolutely.
If there is a death that happens and the moment you enter into that house, you feel something is not right. Even you might have noticed that people, like, there was an argument going on, and the moment you enter into the house or room, everybody is smiling, but you feel something is not right. So it means that energy is there. What is energy? Energy is not only the placement of the stuff, it is also your thoughts, because your thoughts are gross energy, right? So what happens that when we do the comprehensive assessment, we look at all these 4 things together, and me as a director of clinical services, I look at what could be the most suitable treatment plan for the patient. So multidimensional healthcare is based on assessment, but it is basically, when we talk about the treatment or therapeutic intervention, it could be a combination of anything and everything. There is nothing untouchable. For example, a lot of people, those who are in alternative and complementary therapy, they think we know it all, right? They say, oh, no allopathy.
Right.
Whereas some people, those who are in allopathy, an engineer like you or coming from that background, they say, oh, all these things, that doesn't work. So in what we have created, that before we introduced this concept of multidimensional healthcare in Harley Street in 1998, we worked on that concept for almost a year with our team. We created a team where the medical team, all the acupuncture, Ayurveda, etc., it was in one team, then alternative medicine and the psychology. So what we used to do, that after doing the comprehensive assessment, we look at what could be the most suitable way of treating the patient. Because generally what happens, you might have noticed that in India or anywhere in the world, that people don't talk about it. You go to the allopathic doctor, you just talk to them about your problem. You go to alternative, you go to homeopathy, you go to Ayurveda, you go for healing, but no one is talking to each other.
To each other, absolutely.
And what we notice that if you don't talk, you do not know what exactly you're treating.
Right.
And how it is affecting, because everything is interdependent. When we talk about health, it looks like different, but like all our organs,
absolutely,
they work in harmony with each other.
Absolutely.
Right? So everything is interdependent. So the concept of multidimensional healthcare comes with understanding that if you want to do or give a better recovery or holistic recovery, you need to address all these 4 dimensions together.
Wonderful, wonderful. That's great. And I think on similar line, you explained and you talked about in your different articles as well, the mind body connection. So want to understand from your perspective how this connection works. Can we treat actually the body part using the mind or vice versa?
So just think about it. When you are under stress, what happens? Simple question I have, right? When you are anxious, what happens?
Right. Yeah.
When you experience any sort of physical conditions, it's not affecting your body, it's also affecting your mind. Now, they have a connectivity because mind and body are connected. For example, when you're under stress, your brain is really getting the message that there's something not right.
Right.
So what you do, like we're coming from our ancient makeup, for example, cave mindset,
Right.
where there was always a problem. If somebody is going to kill us, predators were there. So cortisol comes like when you're under stress. What cortisol does, it gives you fight or flight symptom. That is what we use. Now, we don't have any physical challenges as such. No animal is going to kill you, right?
Right.
No one is going to kill you and shoot you openly.
Right.
But our brain is working that way. When you have more stress, you have more cortisol in your system. When you have more cortisol in your system, generally, cortisol goes clear in 7 minutes, in 5 to 6 hours. But if you're in continuous stress, what's going to happen? That it stays in your system for a longer period of time, and it start affecting your immune system, right? That's the reason that people, those who are under tremendous stressful job, they develop cardiac problems, diabetes, and many others. So we understand that there's a connectivity.
So, sir, one thing that stand out in your work is that how you blend multiple clinical tools like CBT, DBT with mindfulness, hypnotherapy, etc., etc. How do you balance these two worlds, which is like evidence-based therapy and also like ancient methods?
I think in psychology, we're seeing a lot of transformation. Say, for example, DBT, ACT, acceptance and commitment therapy, compassion therapy, for example, mindfulness. They are very deeply associated with the ancient philosophy. For example, if you talk about mindfulness, the foundation of mindfulness comes from Buddhist philosophy or Vipassana. But when you talk about Buddhist philosophy, it comes from Kashmiri Shaivism. Say, for example, Buddha, when he got enlightenment, he practiced something that is a perfection of understanding the mind and body connectivity through breathing. It's called prana. What he noticed, that to win or to understand your unconscious mind, you need to see and feel the connectivity between body and mind. And in Kashmiri Shaivism, there is one of the techniques. The whole world, whatever the meditation, what we see here in this world, they have a foundation somewhere or connection somewhere with the Kashmiri Shaivism, which is a dialogue between Lord Shiva and Ma Parvati. There are 112 techniques what Lord Shiva shared with Ma Parvati. And one of the techniques is about breathing, the prana, you know.
Oh.
Now, with this prana, Buddha shared the wisdom that only by understanding your unconscious mind, the root cause of our suffering comes from only two things. One is a fear, another is a desire. Fear of losing what we have, or desires what we don't. And then he started working and he started practicing, and then he shared what we call mindfulness today. Now, this mindfulness, that was very much needed, say, 20 years ago, 30 years ago, because if you talk about the Western approaches of behavioral modification, it wasn't working effectively. So now I see that there are a lot of Eastern approaches, even dialectical behavioral therapy, which is quite powerful in treating the conditions like borderline personality disorders, relationships, etc. They are coming with the Eastern tools. So I see that the world is already moving towards that.
Wow.
I'm sure that the more deeper we go, we'll see the power of spirituality as a way of achieving good mental and physical health. So I can see the blend that is already happening. Obviously, when we started in 98, it was quite new. But we started talking about the mind and body connectivity. I developed something that is based on energy psychology, that your mind and body are connected, and then whenever there is any thought that enters into your mind, it affects your body.
Wonderful. And in the similar line, what do you suggest to our audience how they can balance their mind and body, bring the harmony between both?
So first of all, I think let's talk about this in three ways. First, understand the mind and body connectivity. So your mind and body, they are connected through your breathing. It's called prana. So if you want to master your mind, you need to master your breathing. So whenever any thought that enters and disturbs, say for example, when you're angry, what changes? Your breathing.
Yeah.
When you get excited, what changes is your breathing.
Right.
Right? So your mind and body, they are connected through your prana or breathing. So first of all, understand your breathing. Secondly, this is your mind and body connectivity. Second, which is very important for us to understand, that in West, we talk about mind, it's a flow of thought. But what does it really mean? Because if you read Patanjali, now Patanjali has beautifully described the functions of mind. He said that there are three functions of mind. The first function of the mind is recording. How we do record? We record through our five senses. Then the second function of mind is the power of discrimination. For example, you're listening to me, but you're also analyzing it within yourself, whether whatever I'm saying, it makes sense or not, isn't it? It's a power of discrimination. Right. But what he said, the major challenge is what we experience in our life, that is the third part of functioning of the mind, that is called ego. What is ego? It's identification. So first understand that whenever there is any sort of recording that is happening in our life, that's why Gandhi's concept of Bura na dekho, you don't look at things that are bad, or the senses inputs or sensory inputs what we have, they are quite important for us to understand that they are affecting our mind and body.
Right.
Right? If you understand that whatever the input you give to us, to your mind and your body, or to your mind, your body is going to experience that.
Right.
Right? So what does it really mean? That we are nothing else. We are just an accumulation of atoms, for example. Thoughts are what? Thoughts are inner dialogues. It starts with something. For example, that if someone start fighting with you. Right? There is a reaction. Now, reaction, what happens? Why reaction is happening? Because sound creates vibration. When there is a vibration, it creates feelings, emotions, and outcome. So understand that if you want to really balance your mind and body connectivity, you need to understand that do you have a power of discrimination or not? That's how cognitive behavioral therapy started. You know, I'm very frightened, I'm very fearful. But start contemplating. Contemplation means metacognition, thinking about your thinking. Is it real or not? 99% of the time when we experience any sort of anxiety, we are just predicting the future based on past or our past experiences. So understand what belongs to you or what doesn't belong to you. So these are the ways by which you can understand the mind and body through sensory input. Try to minimize the sensory input that is nasty. I mean, a lot of things what we see here in this world, they are creating energy disturbances.
Right.
So first of all, understand, and that's not only, not only to the adults, but also parents. They need to really understand that, the kind of influence what their children are facing right now by watching certain programs on TV, they will shape up their personality.
Right, right.
So vibration, emotions, and then feelings and action, they all are interconnected.
Vibration, emotion, feeling, and actions. Wonderful. I mean, I can clearly see, especially on the new context with a lot of social channels, lot of the reels, stories we keep seeing, and while you're seeing that, you sometimes you lose track of what you are watching, right? And you kind of goes into that negative mood of watching one thing, and then it keeps up to others. I think that changed a lot of psyche of us.
That's the reason why we are experiencing more and more mental health problems. I mean, to be honest, what I see and what I heard so far, that even in India, we have, India has become a suicide capital, for example. Now,
Right.
we will have a major challenges of mental health by 2035, and we're not prepared for that. Why? Because we're losing the culture. We're losing our spiritual connectivity. Because when your spiritual connectivity is there, for example, when you talk about the consciousness and you talk about the neuroscience, I think one of your questions is also very much related to that. Your brainstem is the seed of your consciousness. Now, there is one researcher based in Sharjah, Dr. Vakran. What he discovered or decoded that a lot of temples or a lot of places in India, India is a seed of consciousness. So when you go to the temple, for example, and you sit there, you're not on a very much deeper level, you're connecting with the supreme consciousness. So that's the reason why the Indian culture started the concept of pilgrimage. Up jao wahan pe, you go there and sit there, go to the temple, sit in the temple, garba gray, because it is the source of energy, source of consciousness. And when you connect with the consciousness, two things happen. One is a surrender, and second is acceptance. A lot of time on a psychological level, we are facing challenges because we do not really understand the concept of acceptance.
Right, absolutely. I can totally relate to it. There are, sometime when I visit certain kind of temples, even certain cities like Banaras, I visited, and it gave me, I don't know, a weird sense of, kind of fulfillment. It was, I don't know, somehow that city itself.
The vibrations.
Yeah.
So there is one. Recently, I think a year ago, I was invited by Yogi Adityanath in UP, his team, they wanted to develop a Vedic research institute, a global Vedic research institute in Naimisharan. Now, if you get an opportunity to go there, the moment, if you're open, the moment you enter into the energy field of Naimisharan, you will feel peace. Why? Because it is said that there are still 72,000 gurus or siddhas, they are still doing the meditation there. So everything is a vibration. What I said,
Right.
everything is a vibration. Connect with the vibration. Connect with the consciousness. Connect with your inner core. Whatever the religion you follow, it's nothing to do with the religion. Dharma is a concept where if you do the right thing, whatever the input you're going to put, that's the concept of karma. You know, if you do the right things will follow.
So on the same context, and we are the generation of quick service. Can you suggest a quick practical approach or tip which our audience can take?
Okay, so I think most of the time people in this world, I'm going to share something very simple but very profound. That is like if you experience any sort of sadness or depression or anxiety, or even if you have any suicidal thought, what you need to do, right? So just think about that mind either goes into the past or it goes into the future, isn't it? That's the function of the mind most of the time. When it goes into the past, what happens? It looks at the problems, challenges, maybe some sort of pleasures, etc. When it goes into the future, it predicts the future. So if you're experiencing sadness or if you're experiencing anxiety, what you can do, for example. So I'm going to share one very small technique with you. So can you see my body? Can you see my legs, my thigh? Just think about your left side is your past, right side is your future. Just I want you to practice this. So your left side is your past, right side is your future. Where is your present? In the middle. What is in the middle? Your nose, your breathing, right? So just close your eyes for a minute. Now take your mind into the past that creates any emotions or any, recording that has happened might be disturbing. The moment you are there, just open your eyes. Okay? What I want you to do, look at me. So I want you to tap here. Stop, stop, stop. Say it loudly.
Stop, stop, stop.
Deep breath. Say present. Present. You need to say present.
Present.
Yeah. Where's your mind?
Present.
Wonderful. Now close your eyes again. Take your mind into the future. Anything that brings any anxiety or fear or restlessness. When you're there, just open your eyes. Okay? Now, that was easy. Okay? So now you need to do the same.
Okay.
Stop. Say it loud. Stop.
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 Deep breath. Present.
Present.
Where is your mind?
Present.
Right. Simple technique like this. You don't need to do it loudly. Understand where your mind is going. If you are staying in the past or you're staying in the future. This is the technique I have developed after seeing very serious patient of PTSD, army officer in the UK.
Right.
And by using this technique, he recovered quite well.
Wonderful.
So these are the techniques, they are very powerful. So start practicing it and you will see the benefits.
Wonderful. Sir, that was really insightful, and thanks for giving the practical tip. I'm sure our audience will be deeply benefit from this tip. Before we kind of move to the closing, want to ask you that can you share an insight or message to anyone who is on healing journey? They are currently going through a trauma or problem or medical issue. what your advice would be for them?
I think meditation is the key. Understanding your mind and body connectivity is the key. Understanding the positive outlook. See, when we understand that our body is just a tool. Soul is something which got a continuous journey, but the ultimate journey of soul is to attain bliss or attain supreme understanding or moksha. What does it really mean? It really means that if we understand that our goal is to understand who we are, experiencing the soul, that is the ultimate journey, then all these challenges what we are facing in our life, they are part of our journey. So acceptance, surrendering, and maintaining positive outlook in your life, because don't just connect with the body, understand that our journey and the soul has no body, it is a continuous process on its own.
Wow. Thanks so much for those insight. And finally, our show is called Medical Value Talks. How you you think about this phrase and whether it connects to your mind body concept?
Medical value, that what you're talking about, what we just discussed, it got a value. So medical value is also, we are not talking about just medicine. Mind and body is also medicine.
Right.
Mind body medicine is itself is a. So I think what you started is wonderful, and I'm sure that you have a long journey. You can educate people. You can also transform their life, make their life better. Listening to someone doesn't make any difference. What matters is that if there are any key messages that we can integrate in our life. It's awareness is the first key towards the enlightenment too.
Amazing. Thank you so much, Dr. Sukul. Your ideas were really insightful, really profound, and I think I really like the idea of that healing start from within, right? From deep conscious level, and then definitely with your inputs, direction, I think our audience will greatly benefit for it. Thank you once
Thanks a
again for
lot for
coming
calling.
to our podcast.
Thank you. Thank you, Nitin.
Thanks.
Thank you.
And for all our listeners, remember that care doesn't stop at the clinic. It begins with the awareness and compassion, as Dr. Sukul was speaking about. Thank you once again, and keep watching MVT podcast. And we look forward to host you again on our next episode. Thank you.